Okay, folks, we'll get started in just a minute. Please remember to mute your phones. Okay, everyone, good Wednesday morning. It's 9:30, and we like to start these things on time. Thank you so much for joining us today for this edition of Office Hours. I'm Kara Kumari, Assistant Commissioner of Communications and External Affairs for the department. I'm joined by Commissioner Turner and the entire DIDD executive team. As always, we do have several questions that have already come in, and we'll get to addressing those first, but we do have a couple of things we want to let you all know first. First of all, we will have a special edition of Open Line going out shortly after this meeting. We'll talk about some of the things that are going to be included in that, but it is very important that you all review the attachments that are included on that special edition of Open Line as well. Before we talk anymore, though, we're going to start things off the way we always start things off, with intro from DIDD Commissioner Brad Turner. Commissioner.
Thanks, Karen. Good morning, everyone. Again, thank you for your participation today. We've got well north of 200 folks that are on this call, and we certainly appreciate every week your engagement and investment in the time that we get to spend together. So we're excited to be able to answer some questions that have been submitted today, and obviously we want to make sure that we can do our best to be as transparent as we can in those questions, but also the questions that get submitted in the chat box. So if questions do come up that you think about as we're having this conversation in office hours, please make sure to let us know. Got a lot of good things to cover today, a lot of very important things. One of the things that Kara is going to touch on is the conversation around testing and positive staff testing and some of the things that we're hoping we can do together to make sure that we eliminate some of that and work together to be as diligent as we can related to the pandemic that's still going on and making sure that we're taking care of those individuals that we're tasked with supporting. So with that, I'm going to kick it back to Kara and let her start the conversation. Kara?
Excellent. Thank you, Commissioner Turner. And as Commissioner mentioned, we are going to talk about staff testing and some guidance that we're issuing shortly after this in relation to that. I will pivot over now to Dr. Bruce Davis to discuss a little bit more about what you all should be seeing in your inboxes within the next hour or so.
Hello, everybody. So these last couple of weeks have continued to be very difficult for not only staff who are working in homes, and actually the rate of increase has gone up even more for persons supported in these last 2 weeks. We have had an 82% increase in cases for persons supported and 85% increase in cases for staff who work in our Medicaid waiver homes and other homes throughout the state. So that's quite an increase. And if you recall, a couple of weeks ago, there's this rate of 10 cases per 100,000 residents that the Department of Health uses to determine when there need to be limitations on visitation and other types of limitations. And so our rate for persons supported within our IDD community has been 97 cases per 100,000 for staff. Let me restate that. It is, I'm going to have to recalculate that. For persons supported, it's been 50 new cases per 100,000. That is a significant increase, one that indicates we need to be on the lookout. We need to be very careful about what we're doing. And, we did a survey. We haven't completed the survey yet. We do know that people are anxious to get back into the community, to get back re-engaged. To tell you the truth, my advice to persons supported at this point would be, this is the time really not to engage. And I know we did that already. We already went through that lockdown period, and it's sort of, in some ways, was mistimed, because now's really the more important time that people should be doing that. However, we do know that people are anxious and that you can't go on with this forever. We're going to put out some guidance regarding that in the coming days, but I just want people to know that if they have the ability to make this decision to stay locked down at this point, they probably should. The other thing that we think is really important is staff testing during this time. And so the commissioner has really, been very diligent about moving forward to get staff testing arranged for our folks. And so it's really, based on this substantial increase in positive cases, knowledge that asymptomatic people spread the disease, we're asking providers to set up a staff testing program as soon as possible. The Department of Health established a procedure specifically for IDD settings to test all their staff each month at no cost to the agency or the person receiving the test. And so in this plan, you're going to receive the testing supplies through a company named Everlywell. And so you will have the ability to register your agency online through the Department of Health and order testing supplies. Staff, these will be self-administered tests. So staff will be able to administer the test to themselves and receive the results via email or on Everlywell's online portal. The agency is going to collect those results from their staff and take the appropriate actions that you need to take. If people need to be, people are positive, they need to be quarantined or isolated, then you will do that. Agencies will continue to report positive test results to DIDD, and also there is an additional provision to report those results to COVID-19 testing at tn.gov. So that's the Department of Health website or email for testing. And so we're not mandating this testing, but we are really strongly recommending it in response to this increase in positive cases. There's really, I'm going to say this, and I don't want to minimize the importance for other agencies, but I want to say that if you're serving people who are in homes of 4 or more persons supported, so any home where there's 4 or more persons supported, or if you're serving persons who are over age 55, have chronic health conditions, or in severe, profound range of intellectual disability, that you will definitely want to establish a staff testing program for those folks. We're not going to do regular testing of persons supported, but we are going to continue to do spot testing as we have done in the past. And so this would be based on symptoms or exposures. And when you have supported who has symptoms or has been exposed, then we'll still have a limited number of path group multi-swab specimen collection kits on hand for this purpose at our regional offices. And so these are the tests that allow for the anterior nares or front of the nose test, essentially, to be able to do this. And to obtain these tests, the person's primary care provider must order it, and then the order is sent to the DIDD's regional nursing directors, who will arrange for delivery of the testing supplies and assist with testing if needed. So that's our testing program. The other thing I want to mention here as we're talking about this is everyday precautions that people need to be taking in their settings. So to the extent that you're having visitors, you're having other people come into the home, there needs to be a screening before every person enters the home or workplace. This is one of the key things that we've been doing all the way along that I think it continues to be of great importance as we move forward. Everybody needs to have easy access to hand hygiene. So you need to wash your hands for 20 seconds with soap and water periodically, but you also might want to have each staff to have a hand disinfectant in their pocket so that they're able to clean their hands at other times and to become obsessive about that. Person supported should also have easy access to being able to sanitize their hands. And so you want to make sure you address any safety issues there, but we want to try to really promote this hand washing because it's one of the key things that prevents the spread of COVID. Posters of do's and don'ts on face coverings. So, one of the don'ts with regard to face coverings, don't touch your face covering because you're invalidating it once you do that. You need to be careful about those types of things. Do not wear them down on your chin like a chin strap. You're not made to do that with. So those are a couple of don'ts with respect to that. But you need to have posters up, reminders to help people remember to do those things. Training on how to wear protective equipment. So as you're putting the mask on, as an example, you don't want to touch it and invalidate the mask as you're putting it on. Wearing cloth face coverings or masks at all times. And so this would be both at work and in public, and really anytime the staff member is at home and in public, they need to do this as well. I know that we don't control people's out of work behavior, but we need to be educating them and helping them understand the importance of these things. Routine cleaning and disinfecting of high touch surfaces is another critical thing. Anything that's handled on a regular basis or touched on a regular basis needs to be cleaned thoroughly. And so this is our responsibility. We spend a great deal of time with people. We're very close to them. We need to be mindful of our professional responsibility to social distance, though. That is such a key aspect of all of what we're talking about. And so there are a number of resources that we'll be sending out with the letter that Kara mentioned a moment ago. We are also going to do a little bit more monitoring of some of these things than we've done up to this point. And so we know that most agencies have procedures for when a DSP tests positive for COVID-19. We've previously not asked to see these plans, but based on the increased number of positive cases, we'll now begin to ask to see a sample of those plans from providers. We'll be giving you some feedback on those, and we'll also be checking with you to make sure that you're doing the appropriate isolation or quarantine procedures for staff who do test positive. These are just measures that we think we need to put in place to ensure that we address the problem that we're now all facing with this COVID-19 crisis. Kara, I think that sums up what we're planning, and certainly be happy to answer any other questions that people may have.
All right, thank you very much, Dr. Just to make sure that you all are aware, there will be 4 total attachments to the open line that will go out today. One will be in regards to the residential special needs adjustment that Dawn indicated in the chat went out yesterday from TennCare. It is the same memo, but we will also distribute it via open line. We also will have the standard operating procedure for the Everlywell test. We will have the guidance and everything, and some of the specific things that Dr. Davis just mentioned, and then we will also have some DOH guidance as well. So we are going to start with some of the questions that were submitted prior to this. The first one, if the person is on here and can clarify this question, the question was, the deadline is pretty soon considering we are still dealing with the pandemic. How is this pandemic going to affect the planning? If this person is on there, if they can reply in the chat box and let us know what deadline they're specifically asking about. We were unsure of what of how to answer that question because we don't know what the deadline is. So I'll move on to the second question that was asked. For agencies that have already had several desk reviews completed, when should individual comments and narrative results be expected? Pat is here on for QA, and she will discuss this.
Good morning, everybody. Thank you for the question, and I'm happy to try to clarify how we are conducting these reviews for the remainder of the year. If your agency has already provided information for a waiver individual record review, those have been reviewed for the most part, and we have provided feedback to the agency if there were issues. So if you have not heard anything, that is a good sign that we have not seen issues in those that have been reviewed. So that's the first part of our survey or our review process for this year, and that is the part that we are bound to do in order to maintain CMS compliance. The revised or adjusted QA survey review that was mentioned last week in the special edition of Open Line addresses the remaining portion of our reviews. And we do have additional desk reviews of other individuals who are supported, as well as staff qualifications and training reviews. And then if possible, and our fingers are crossed we can do this later, that we are able to do some on-site work. The results of all of that will be communicated to the provider once those components of the review are finished. I hope that clarifies where we are with this process, and I do acknowledge there are a number of steps here that we're dealing with. So if you do continue to have questions about this, please contact your regional QA administrator, that's Beth, Michelle, or Dean. Or me, please, and we'll attempt to further clarify. Thank you, Kara.
Thank you very much, Pat. Okay, the next question that we've got is about since there is no end in sight to the COVID-19 situation and due to the increase in positive cases, has there been any consideration of changing the way positive cases are reported to DIDD? I'm going to pivot to Teresa Sloan on this one, but I also think we're going to address at the same time. We did get a question in the chat from Donna about rumors that folks could be sanctioned for late reporting of a positive test result. And that's one of the reasons why we're here every week, is to make sure that we can separate rumors from truth. So I'm going to let Teresa Sloan talk about, discuss some of this stuff. And I think Commissioner Turner might also want to have something to say as well.
Thanks, Kara. I'm going to start by answering Donna's question. We are not sanctioning. There is no intent to sanction for late reporting. Donna, if you have a specific case where you believe this happened, if you can send me that information, I will look into it and I will get back with you personally about it. Kara, as far as changing the way reporting is happening, no, we're not considering changing that at this time. It is crucial that we get that information as soon as possible so that we can begin contact tracing to try to notify other provider agencies as to the fact that they may have been exposed to a staff person who's tested positive that works at another agency. The best way to do that is to continue with how we are currently having reporting submitted to the department. I hope that answers the question. If there's any further comment on that, I'd be happy to answer.
Commissioner, did you have anything you wanted to add?
Yeah, just real quick, just want to echo again, Donna, what Teresa just said. I would certainly be interested to know where that information was coming from, because that's not anything that has been shared with us. I guess it's possible that that might have been relayed from the Department of Health or some other department that's responsible for some of this, but that is not something that we're aware of. So to Teresa's point, please let us know where you're hearing that from, because we certainly want to nip that in the bud, because that's not something that's coming from DIDD, nor is that something that should be coming from us, because that is inaccurate. Thanks, Kara.
Sarah, if I can follow up, I think Donna has made a comment that it was from an investigator. Donna, send me an email with that specific information, and I will follow up on that, as well as Vicki Loveday. If that is the case, that was misinformation, and we will ensure that that does not occur again. Thanks, Kara.
All right, thank you very much. And like I said, one of the reasons we're here is so that when you do hear this stuff, please contact, we've provided this open line of communication so that hopefully we can address and clear up anything that's out there. The question about the deadline is in regards to the IDD integration question, and will the fact that the pandemic is happening slow the process and all of that stuff. I will pivot over to Jordan Allen, Deputy Commissioner of Program Operations, to discuss the timeline.
Yeah, thanks, Kara. Good morning, everybody. So obviously the pandemic is affecting business operations and systems across the board right now. I think it's much too early to tell as to what impact the pandemic will have on our ability to collect stakeholder feedback and to hold virtual forums. What we found thus far is while virtual formats aren't always, I don't think, as directly effective as us being able to sit down in a room together, communication across participants is a little more difficult, and there are some challenges. I do think we're getting much better at it as a community, and we haven't seen anything yet that from an attendance standpoint or from a feedback or communication standpoint that would lead me to believe that the things that we need to get accomplished in order to get an effective amendment drafted, to get that amendment submitted, and certainly the internal process adjustments. Some of the things we've discussed already are looking into network management details, credentialing details, thinking about a single point of billing approach or system. Those things are not or have not yet been hampered at all by the COVID pandemic. And folks have been available immediately and certainly ready and willing to participate as we now move into a more aggressive stakeholder feedback phase. If what we notice is that the pandemic is dulling the availability of people that need to be able to give input, then we'll make those adjustments as we go. But I don't think we have any plans at this point, nor have we seen any indications that we wouldn't be able to meet the deadlines or the benchmarks that we've set for the alignment process.
Thank you very much, Jordan. Another question we got in was about sharing information about the questionnaire that was sent out to people regarding day services. That was sent out via the ISBs about the appetite out there for resumption of day services. The deadline to fill that out is the end of the week or the end of the month. So that's why we don't have the results to share with you right now. I will say that at this point, 1,100 responses have already been submitted, and we will be sharing this data at office hours next week. So we will provide some of that information so you all can see some of the data points that we're seeing. Now, what that means, as Dr. Davis said, is just because some of the data is showing us and the results are there, it's letting us know that there are some people who are anxious to return to day services. But as he said, obviously right now we're seeing some unprecedented increases in COVID positive cases. So obviously that weighs heavily into any decisions that need to be made. Okay, so we will go to questions that are in the chat box, and there are a lot of them, and we might not be able to get to all of them today. First, Dawn has asked whether or not referencing the memo that was sent out from TennCare and will be sent out in that special edition of Open Line. Will this rate differential be extended to meet this critical expanding need? Andy, Deputy Commissioner Kidd, would you like to discuss this?
Yeah, thanks, Karen. Good morning, everybody. That's a great question, and we are working with TennCare to see what we can do to extend that. What we need right now is for all the providers to go ahead and submit those additional claims for the rate differential payments so that we can calculate exactly where we are of the $500,000 that was allocated for that. Once we have a good grasp of that, we're going to work with TennCare and the administration to see what we can do about getting additional funding. But again, right now, we just need to make sure we know exactly where we are for those additional claims. Thanks, Kara.
All right. The next question is does the routine testing exclude the staff who already tested positive? Dr. Davis?
Yeah, staff who have tested positive within the last 3 months are not required to be tested again. So they would have been cleared by symptom at that point. And so it's not necessary to retest those staff within a 3-month period.
The next question is do you have any projections on how long it will take to get the results of the test?
Yeah, I saw that question. I do not know how long it will take to get the results. I do know that we have all been facing slow results here of late, and the Department of Health is working hard to identify enough providers to be able to get results back in a timely fashion. I actually think Path Group has continued to provide results in a reasonable, timely fashion. Maybe sometimes they've gone up to maybe 4 days at the most for them. I don't know what Everlywell's track record is with respect to that. I will say that I think testing delays are going to be resolved at some point. And so that's not a reason to not do the testing, is because of the concern about slow results. I understand that puts us in an awkward position as it relates to how to respond. I do want to remind everybody of the idea that people who are asymptomatic and awaiting test results can continue to work if they're critical healthcare personnel, which all of our direct support professionals would be, nurses would be, et cetera. And under those circumstances, if they wear a surgical mask during their work, they can continue to work if they are asymptomatic. So there are options that you have available when you're waiting test results. And I am going to count on the Department of Health to be able to decrease this timeline for getting those results over the course of time. And I think that will happen. Kara?
Thank you, Dr. Davis. The next question was, can the department help find a source for hand sanitizer? Andy?
Sure thing. We'd be glad to help with that. If you'll send an email to the DIDD COVID email address, we'll be glad to put you in contact with either suppliers or help you find some of those.
The questions we got, next question was, will the recommendation that Dr. Davis just communicated be on the department website and in an open line? It will be on both. We'll send it out in open line, and then every time we do update our COVID-19 page with that information. So you will be able to find it in both places. The next question, Dr. Davis, is about the Department of Health, and that positive cases should be reported to the local health department or Department of Health, but that notifying both is not necessary. Do you have a little bit more information about this procedure, Dr. Davis?
Yeah, I think they're getting notified a lot about these cases, but I think they're trying to just make sure all the bases are covered with respect to that. I cannot speak to the local health department versus central office Department of Health discrepancy that may exist there. I will say that the agencies like Everlywell, who does the testing, is reporting those results back to Department of Health. So they're reporting their positive and negative cases as well. But I do think that it's very important for us to explicitly follow the instructions that are in the documents that you're going to be receiving about how that reporting needs to occur. And if there ends up being some double notification of people, that's not the worst thing that can happen. Kara.
There is a question now. We have folks being discharged from the hospital back into their homes with roommates. Would there be a way to waive transition protocols to move people around to avoid this? Teresa, can you weigh in on this?
I think we need Jordan to weigh in on this one. I can answer Bill's next question regarding the reporting. Sorry, Kara.
Okay, no problem. If you want to go ahead and answer Bill's question about the reporting, and then we'll come back to the transition question.
Okay, I'm going to try to address Bill's question, as well as there seems to be some similar questions that are asked. Bill, we do have a form that is available to folks who are involved in the process at different points of contacting the provider for information. And that is available to everyone to pull up and look at. The process begins with, the investigator, and they'll ask the questions, but lots of times the person reporting won't have the answers to those questions. So the next step in the process is sent to the regional nurse, who will reach out to the provider and hopefully to a person at that agency that will have those answers to the questions that we need. And as regards to the positive, if I'm reading it, I'm assuming that's when we did maybe the mass testing and it was reported back to providers that there was a positive. Again, that was a process separate from the reporting that was done with Dr. Davis's staff in conjunction with the Department of Health. So that's why those notifications would have come from a separate individual. I know it seems like a lot of folks calling, but I promise you there is a process where the form moves from one person to the next person who is the best person within the system to gather the information that is needed. And again, all the folks in the process do have access to that information. To answer the next question regarding the form, if there's a template or something, yes, there is, and I can get with Kara after this call, and we can put that questionnaire form, which are the questions that are asked by the investigator, as well as, Teresa, is it already up there, Kara?
Teresa, that's been up there.
Okay.
Tomorrow, but I'm gonna show you all where it is as you talk. So I'll be sharing my screen in just a second.
That's perfect. I had thought we had put it up there initially, but there's been so much information that I wasn't sure, but thank you for confirming that. And that information is exactly what is asked during those calls. And to go on to Regina's question about multiple calls from different nurses, asking about the same staff exposure. If that's occurring, I would need examples. What I think may be occurring here is that we will have a report about a staff person who has, been exposed, or a person tests positive, and they give us the names of the other folks who have been exposed. So we make those calls. We may later, in a couple days, get a report of another staff person in the same home or at the same agency that may work with other staff person that may be, some of them may be the same staff person as before, but we still make those calls. If that's not what you were asking, Regina, and you believe you're getting the same calls about the same actual situation, again, if you can send me an example, we can look in and kind of get a better answer for why that may have happened in that specific case. Kara, I think that may be, I'm trying to make sure that I'm getting to all the questions that have been put up here in regards to that form and the contact information. I think I hit them all, Kara. If anyone has any follow-up, I'd be more than happy to answer them.
Sure, and thank you very much, Teresa, for answering all of those questions. You'll see that I'm sharing my screen, which does show that we've got the data collection, and these are the questions that are being asked as we call and look for information. And just so you all can see, I'll kind of backtrack out. That is under the testing and results guidance. You can see that we update the positive cases every single day. We have the chart that we shared a couple of weeks ago. We have reporting requirements on there, and then we have all of our attachments as well. Just so you all know, once we have all this Everlywell stuff out there, this is where this stuff will be found under that testing and results guidance tab. So, so that is where that will be able to be found going forward. So I will stop sharing, and so that way I can take a look. Okay, so we'll go back to the transition question, and Jordan is going to answer that one.
Thanks, Kara. So we can't waive transition protocols, but what we can do, I guess really it's a two-pronged answer. The first of which is reach out to your regional office, and we can expedite those processes. And then the second part of that is we do have flexibilities within the Appendix K approved submission that allow for provider agencies in the event of emergency related to COVID to use alternative treatment sites. Obviously, we've only thankfully had to access that a handful of times thus far, but we want to do everything we can to assure that the alternative environment is appropriate to support the needs of the people that will be moving into it. And so, you know, therapeutic site assessments and other processes do need to be engaged, although those can be engaged simultaneous or even in the event of true crisis after a move has occurred. And we've executed that process a couple of different times. So if you have people that are moving from hospitals or nursing homes, or we have emergent transition requests that are the result of COVID, reach out to your regional office, and certainly we'll do everything that we can to expedite and clear barriers to allow those moves to happen in the interest of safely supporting all folks.
Thank you, Jordan. The next question was an update on the budget. Commissioner Turner, do you want to talk about about this? And also, this might also be an opportunity for you to discuss the release that went out from the governor's office yesterday or last week about the $150 million to aid nonprofits and how that might assist folks in our service delivery system. So would you like to address both of those things?
Certainly. Thanks, Kara. So number one, we we do not have an update on the budget yet. And there's no timeline on what that update might look like either. Again, as soon as we hear something that's concrete, we will be able to share that information with you, but we don't have a new update. The second part of that Kara had talked about is very exciting and very important, related to the governor last week announced that there was going to be a Tennessee Community Cares program, a new aid program of about $150 million that are going to be dispersed across Tennessee to serve Tennesseans through nonprofit organizations. And this was very important for us because the governor's office actually called me to make sure that our population and individuals that we support and providers like you are aware of this opportunity to submit a request for the grant. So as you go through this, I want one thing to be very clear. It is a first come, first serve. So we need to be very, I would encourage you to really be proactive related to your grant submission in your area for any of the nonprofits that might have been eligible to disperse that, or the grant providers that have been eligible to disperse those in your regions. There's a number of examples that you can utilize some of these funding for, whether it's food assistance or anything related to vulnerable populations or, eviction, residential things. There's a lot of flexibility built into this, but the key is it can only be honored for the timeline of the pandemic. So anything that started around March 1st, anything before that, you really can't submit for, but anything that has been going on or has happened since March 1st, that's what the financial aid and some of this is going to be geared towards. So there's a lot of good things that come out of this. Naturally, the support, is targeted towards at-risk and vulnerable or underserved populations, which obviously we check a lot of those boxes. So I just want to make sure that I encourage you that if you have the opportunity to pursue a grant like that, please do and do so as soon as possible. I believe that they're going to slowly start taking those grant proposals on August 1st. So that'll be the end of this week. So start looking at that and identifying some areas and some individuals in your region that might be eligible for some of that assistance. Thanks, Kara.
Okay, and I'm looking through right now. who is administering those grants. We haven't seen a list of places to apply. If you look, I think the information that's been out there so far was in open line on Friday. So if you've got that, so you can take a look there. I think Commissioner Turner might have more also.
Yeah, they're also, thanks, Kara, and an extension of that, I should have touched on that, Ann, so that's a good question. As Kara alluded to, there's information inside open line, but there's also going to be information that's going to be placed on the Human Services website and Commissioner Barnes' team. So both of those areas, I would check open line first, but then once things start happening around the first, my understanding is that there's going to be information that's going to be available through the Department of Human Services and Commissioner Danielle Barnes' area. Thanks, Kara.
All right, and then we have some additional reporting questions. So if Teresa, I think, is going to hit those, and while she does, I'm going to navigate back over to our website and share my screen.
Thank you, Kara. And I'm going to, again, try to hit these as I'm answering them, move the comments down. So if I miss one, someone please let me know. So if we start with the question about asymptomatic testing, do we need to submit a ref if they come back negative? Kara is going to, pull up the process right now that we have on our website for when and where and how you submit different refs in different situations. We need a ref submitted if someone is tested. And then whether they're symptomatic or not, because we are tracking the total number of tests as well as the total number of persons tested. So that information is really important for what Dr. Davis is going to be doing in regards to figuring out the percentages and different things in our population. If that test comes back negative, you just need to submit a corrected ref just showing, or an amended ref just showing that test was negative. So the other, I think, question regarding was the mass testing. No, we didn't require refs or other information to be submitted during the mass testing. That information was actually gathered by the regional nurses during the mass testing and subsequently during the information coming back in, and the nurses submitted that as a whole package back to investigations so that we could draw that information and have it available for Dr. Davis and his staff. I think Kara's pulling up the chart right now. I think it's really helpful if you look at it. It's really simple. For a very complicated process, it really breaks it down into easy steps for knowing when and how to report. I think there was also a question regarding I think Len asked a question regarding the regional nurses asking for a director. I will pass that information on to David Taylor, who is overseeing the regional nurses as part of this process, and ask him if he could advise them to do that going forward, because we do need to speak with the person that is going to have the most updated information. And then I see Candace. Sorry, Kara, I'm just trying to get through them all. This is apparently the day to ask questions about testing, and I'm glad, because we really do want to have this information and be able to help to try to do some preventative measures, or at least do some good contact tracing. A provider is required to report positive administrative staff or just DSPs. We are really asking that you report all staff. This is because we did have a situation at an agency where the positives started with administrative staff, but because direct care staff or nurses were in and out of the office on a regular basis, it did result in direct care staff testing positive from that exposure. So it's really good for us to know that, so we can kind of see where it started from and follow up and be watching and be alerting other people as to the potential. I think I got all of the questions, Kara. If one, I'd be more than happy to come back and answer them, or any additional questions folks may have. And I did see something up here where someone was going to send direct information. I think about maybe being asked the same questions by 2 different people, and absolutely send that. We will look at it, and if we'll do whatever we can to improve our process, because this information is extremely critical for us to be receiving. Thanks, Kara.
All right, and we are out of time. So I'm going to turn it over to Commissioner Turner to give us a couple of words before we continue on with the week.
Yeah, thanks, Karen. Again, thank you to everyone for your participation today. I apologize that we might not have gotten all of the questions, but as Karen shared, we kind of ran up on the time today. But please consider submitting those questions through the email for next week. And again, if it's something that we can answer in the interim, we certainly want to do that. Just want to say how much I appreciate your engagement still and your passion around what we're trying to do. I know that we've all probably accepted the fact that this is going to be with us for a little bit longer, but I'm certainly looking forward to the day that this is over and that I can get back on the road and come see you and come see what you're doing to support people at a very high level. So thank you again for what you're doing, and please express my heartfelt thanks to your DSPs and some of the folks that we don't recognize the way that we always should. I certainly appreciate what they're doing and understand that I can't do my job if they're not doing theirs. So please make sure to pass that on. And with that, I say thank you, and I'll turn it back to Kara to wrap us up. Kara?
All right, that is it for this week. Obviously, we'll be here next week to continue to discuss anything you all want to discuss, and we will share that information about the day services survey that we had out at the meeting next week as well. So we look forward to seeing you again next week and having this chat. We'll see you then. Bye.